Hi, I'm State Senator George Logan. I'm here with Christina Allen. She is the Suicide Prevention Coordinator at VA Connecticut Healthcare. We're here at the West Haven campus. I'm also here with Tom Aleji. He's a Vietnam veteran who's been coming here since 1968, and he's been volunteering here for the last 10 years. So what I'm going to do is we're going to ask them some questions and chat about the work that they do here, particularly related to suicide prevention. So Christina, how are you?
I'm well, thank you.
Thank you for doing this. Thank you for inviting me here. I really appreciate it. So first, tell us a little bit about your background. How did you become involved in veteran suicide prevention?
Sure. So I'm trained as a licensed clinical social worker, and I'm heading into my 7th year here at the VA Connecticut healthcare system. I started my career here on an inpatient psychiatric unit where I was exposed to a wide variety of mental health resources. When I moved over to suicide prevention, I realized that we're able to connect with people when they're in a tremendous amount of emotional pain. And that sort of connection is just so powerful.
Wow.
And working with our veterans really adds another layer of meaning to this.
Oh, that's super. Now let's talk numbers now. First, VA suicide prevention coordinators are managing care for almost 11,000 veterans who are clinically at high risk for suicide. Can you talk about that?
Sure, of course. So the VA has always been a leader in using proven interventions and strategies to support veterans at high risk for suicide. We function as part of their treatment teams to ensure that these veterans are receiving the best care possible. So in a lot of ways, we're putting an extra safety net under veterans who are experiencing a difficult time.
Wow. And can you outline what the suicide prevention program does and how it works with VA providers to help high-risk vets?
Sure, this is probably my favorite thing to talk about. So in addition to that monitoring care, we collaborate with and support all areas of the healthcare system. So that could mean working with our billing department to address financial stressors for veterans at risk for suicide, or collaborating with the VA police on installation of a medication take-back box to reduce prescription drug overdoses. So we're always looking at potential barriers to care and exploring ways that we can break them down. And maybe a boring part of the work, but a part that I think is really important is our data collection, and that allows us to improve the services that we provide for the veterans. And one of the more fun functions of our job is getting out into the community where we provide both clinical training for mental health professionals and gatekeeper training for community members who may be positioned to recognize and refer a veteran in crisis. So we have a gatekeeper training that's called SAVE, and SAVE teaches people how to recognize warning signs that somebody's thinking of suicide, and also provides some strategies for reaching out and connecting that person to care. And that's a training that we provided to everyone, from members of the Army Reserve to volunteers at a senior center.
Wow, that's amazing. You just offer so many different programs and opportunities to help folks out. It's really impressive. You know, VA suicide prevention coordinators conducted more than 20,000 outreach events in 2018. I think we're talking about nationwide, right?
Yes, sir.
Reaching almost 2 million people. What an amazing statistic on the potential amount of lives they have saved. Can you talk a little bit about that as well?
Of course. So that statistic is nationwide, but we consider outreach to be a strength of our program locally.
Yes.
So we're doing anywhere from 8 to 10 events a month. So that could mean going out for one of the Out of Darkness walks hosted by the American Foundation for Suicide Prevention, or maybe having a table at a resource fair or an employment fair, as one of my coworkers did just yesterday. So we look at every event as an opportunity to make new connections and to talk to people about the role they can play in suicide prevention.
Wow, great service. And there's just so much to tackle. You all do such a great job at doing that. I know the goal of VA suicide prevention efforts is to equip communities to help veterans get the right care whenever and wherever they need it. Can you talk a little bit about that as well?
Sure. So the more I do this work, the clearer it becomes that we can't do this alone and we just can't do this in a silo. So it's really critical that we're not sitting back and waiting for veterans to come into the hospital and ask for our help. So because of that, we're working with people in the community who interact with veterans in their everyday lives. And what we really hope is that everyone knows you don't need special training to support a veteran in your life. And just reaching out, providing some kind words or a simple act can really be a reminder that there are people out there who are ready to listen. I'm still relatively new to politics. I'm in my second term. I'm on the Veterans Committee in Hartford, and I'm not a veteran myself, but since joining the Veterans Committee and taking a look at the active veterans community that we have here in my district and in Connecticut, I've realized there's so many veterans scattered, throughout our community. I always try to thank a veteran anytime I see one, whether it's at a gas station or a grocery store. And then, it comes to mind is that this is, as most things in life, it's a team effort. Yes.
Folks have to work together and collaborate and network and feed on each other's strengths. Can you talk about your collaborations with veteran service organizations, medical professionals, criminal justice officials, and private employers in order to meet your mission?
Yeah, what you said is just so important, is that we need to be working with these people to meet the mission. So one example of this would be a first responder initiative. So our team works with a member of the VA Police Department to provide training to law enforcement officers in the community and other first responders. So the training provides some education about mental health and medical issues that some of our returning veterans are facing. And it also gives them some skills and tools to improve their interactions with those that might be in crisis. And because so many of our first responders are veterans themselves, we also encourage and offer assistance with enrollment in VA healthcare.
Wow, that's super. So we talked about the data and the services you provide. All of that is affecting real people. I can only imagine just all of the different situations and conditions. Can you talk about some of those real life success stories that perhaps you've seen?
Sure, I would love to. So a lot of the work that we do in our program with veterans is over the telephone, but we do have some chances to connect with them in person. And one of those opportunities comes when we provide a suicide prevention group on a residential unit here in the hospital. And at the end of group, I usually ask if anybody wants to share a personal experience that they've had with contacting the Veterans Crisis Line. So one week, a veteran had volunteered and he started telling his story about how if he didn't get the follow-up phone call from a suicide prevention coordinator who was encouraging him to come here to the hospital and get the help he needed, he really wasn't certain what would have happened. Yeah, so the story started to sound familiar, and I asked him for a few more details, and then I realized that this was a gentleman that I had just been speaking with last week. Wow. So those opportunities are rare. We don't always get to see the outcome of our work, but times like that really help keep us dedicated.
Wow, I know it's so real. I mean, it's got to be emotional, I would imagine, even for the folks that are working with all of these good people that may be in crisis. As we are wrapping up here, is there anything you'd like to say in summary, or perhaps something we didn't cover in our talk?
Sure. One thing that I want to mention is that we do a lot of work with people who have contacted the Veterans Crisis Line. And that could be veterans themselves as well as friends or family members of veterans. So the initial call is managed by the Crisis Line call center, but if the call originated in Connecticut, one of us will follow up within 24 hours, and we'll talk to the caller, check in, and see what else we can do for them here locally to make sure that they have all the support that they need.
Wow, that's super. Thanks, Christina. And we have the luxury and the privilege of having an actual veteran here, Tom Alegi. And Tom, I want to thank you for your years of service. I really, we all really appreciate it very much so. And if a vet is watching this now, or if a friend or family member of a vet is watching, what would you like to tell them?
If a veteran is watching this, a family member,
Yeah.
an acquaintance is watching this program, I would like them to know that they will receive quality care when they come to this facility or when they contact a crisis line. I have been coming here since 1968, and I've seen the changes, and this facility provides some of the best health care in the New England region. And veterans, some don't understand or don't know about our Veterans Crisis Line. So for the past 4 months, I have been going around the state handing out material to different posts, American Legion posts, VFWs, police offices, mayor's offices, whoever meets people where veterans go, to let them know that we have a crisis line here and they do not have to deal with themselves. They can come here, work the issues out, and have a productive life. That's what I'd like them to know.
Wow, that's great, Tom. And you gained my respect early on when I met you, and I respect you even more now after hearing all of that. And also the fact that you've been coming here since 1968,
Yes.
Especially when I was born in 1969.
Oh, okay.
Quite a bit of time. I know we're talking about, I'm almost 50, so it's over 50 years here. So
Yes.
again, thank you for
You're welcome.
that as well. And this is for you, Tom, or Christina. How can people contact the program?
Sure. So first off, I do want to say thank you to Mr. Alegi. I failed to mention that before, but he has almost cleaned us out of Veterans Crisis Line materials. So he is doing his piece and more.
Thank you.
The contact information for the Veterans Crisis Line is 1-800-273-8255, and then you press option 1 to be connected to the Veterans Crisis Line. The main phone number here at the VA hospital is 203-932-5711, and anyone can call and ask to be connected to suicide prevention.
Wow, well, thank you, Christina. Thank you, Tom. This has been very informative for me. I appreciate you all taking the time out to do this, and I'm looking forward to seeing you in the community, Tom and Hamden, and Christina. I look forward to seeing you again as we go along, trying to help folks in our community as best we can. And again, I'm State Senator George Logan, and thank you for watching this segment of the program.